So ladies and gentlemen, welcome to our last and final seminar, which will be titled How to Qualify as an EECP Patient, Guidelines for Safe Screening of EECP Patient in Outpatient GP Setting by Dr. Wong Teck. Can you please give him a resounding round of applause? Without further ado, I would like to pass the stage to and Mr. Alex Wong. Give him a round of applause.
Thanks everyone to take time to come over. I like to especially thank Dr. Wong for taking a break out of his busy practice to come over and share one of the most important aspect of EECP therapy, which is the patient selections and contraindications. The reason we are doing this is actually to empower whoever that is marketing, whoever is speaking about EECP therapy, that so that we don't go overboard with some of the claims that everything can be done with EECP. Perhaps I'll leave it to the specialist to speak more about that. Dr. Wong.
Okay, good afternoon. So I want to ask all of you here, how many of you have an EECP machine? One? Kenny? Okay, quite a few of you. And how many of you are not doctors? Oh, there's a big group of you. Okay, so I'm going to talk about the patient selection. So I think that's important because the regulation in Malaysia are not so clear. And if you are not a medical doctor running the service, you have to do it carefully. And if you don't get into trouble and you select the patient correctly, then the outcome is better and you won't get any serious complication. So to change the slide without the battery. Yeah? Okay, so the talk can be a talk that can last for a few hours, but today I'll just focus on the safety side. You must select the patient correctly so that you don't get into harm. So some of you here who are not doctors, so I'm going to talk a little bit on the anatomy, a little bit about the mechanism, how it works, and hopefully you can understand. For those who are not doctors, maybe if you don't understand, maybe you can ask me and I'll try to explain it in a simple language. So the principle of EECP is that the heart arteries receive most of its blood during diastole. So what does it mean by diastole? So when the heart contracts, it's called systole, and when you relax, it's called diastole. So when the heart contracts, the whole heart is squeezed and the arteries also squeezed, so no blood flow. So in a normal human, the blood flow into the artery of the heart when it's relaxed. So when the arteries are all relaxed, then the blood flow can come in. So that is the normal mechanism. So when the heart relaxes, in a patient with disease, they may not get enough blood flow. Let's say you have blockage. So this machine enhances the blood flow by increasing the blood flow to the artery when it's relaxed. So I ask you, based on this principle, I ask you who are here who are not doctors, this machine will enhance the blood flow best in which phase of the contraction? When it's contraction or when it's more relaxed? So when it's relaxed, yes. So I think you can understand very clearly. So a lot of people are confused. So when it's relaxed, the normal blood flow goes into the artery. So this machine enhances it when it's relaxed. So it's in diastole when the heart is relaxing. The second thing is that the opening of the coronary arteries are located in the aortic root. So the heart contracts and the blood flow out from the aortic valve into the aorta that supply the whole body. So there's a valve that stops the blood from flowing back to the heart chamber. So this principle is very important because the artery blood supply to the heart is outside this valve. So when you contract during diastole, when it's heart relaxing, so your machine contract, the blood flow force the blood out to the artery. So if your valve is not functioning properly, because the function of valve is to allow blood to flow in one direction, right? So any valve in the car, it must flow, the oil must flow in one direction. If the valve is faulty, then the blood can flow back. So if you increase the leg pump and cause the blood flow back, and if your valve is leaking, so what will happen? If you cause the blood to go inside the heart chamber, and this is a contraindication, and actually will increase work for the heart, because it's not supposed to go in, but now it's because it's leaking, it contract and then go into the heart chamber. So this is a contraindication. If you have a patient like this, cannot do EECP, because you can put them into heart failure. So water will go into the lungs and the patient. Yeah, okay, this one I will talk later. So this is a general principle, the important part that you have to watch out for. So how to identify? I will teach you, but if you are not medical doctor, you have to use some skill. But there are some principles that you can use. Okay, so this is the diagram. You can see the heart chamber divided into. So when you are doing some marketing on this, you need to talk with some medical sense. Otherwise, they think that you don't know what's going on and try to sell them something. So the heart is divided into 4 chambers: the atrium and the ventricle, and the left and the right. So 4 chambers. And then this chamber has a supply going into the chamber, and there's also blood vessels that go out from this chamber. So the left one supply the aorta, that supply blood to the whole body. The right side, the blood is go through the pulmonary artery that go into the lungs. So one go into the lung, one go into the whole body. So this principle also important, because there are some conditions that you cannot use this EECP technique. So just now we talk about systole and diastole. So systole is a medical term for contraction. Diastole is when it's relaxed. So ask you again, when is blood flow to the artery? No, not you. You know. During systole or diastole? Relaxed time. So relaxed time is called diastole. Yeah. Okay. So this is a basic principle. So coronary arteries is perfused during diastole. So just now I spoke about the valve and the artery. So you see the valve is below, the artery is on top. So it's outside the heart chamber. And this aortic valve you can see here, it opens when the heart contracts, so blood flow out. And then when the heart relaxes, if the valve is leaking, the blood flow will get sucked back. So the valve should be functioning properly. But some patient with diseased valve, it doesn't function properly, it leak back. So if you put the machine on this group of patients, you can put them into heart failure. And the patient will become so breathless, and if you cannot send them to hospital fast, they may die in your clinic. So we have to be careful if they have this condition called aortic regurgitation, which is a leaky valve. But if it's a mild valve leaking, no problem. But if it's a severe one, then it can be very dangerous. So this one is supposed to have a video? No video, okay. So no video, doesn't matter. It shows that the artery that supply the heart muscle. So these are the arteries. So sometimes the patient will describe to you, I have a block here, block there, and they have a diagram. So the heart is supplied by 3 major arteries. The right coronary artery on the right side. The one in the middle is called left anterior descending artery, and there's a left side called left circumflex artery. So just remember, there's 3 major arteries supplying the heart muscle. So what is the function of this artery? This artery supply the heart muscle, the pump. So if your pump is damaged, you cannot pump blood to the rest of your body. So when does it happen? How come the heart is damaged? Most common causes is because of blockage. So there's a blockage in the artery, then it damages the muscle, so the muscle cannot pump properly. So the artery is like a petrol supply to the engine. So if your petrol supply is blocked, then your engine is not working properly, and they will will be breathless because the pump is not working. So when is the time when EECP help this group of people, the patient with a blockage and they cannot go for operation, you can consider this therapy. So EECP works by the pump contracting when it's relaxed. So when it's contracting during relax, it's a reverse flow from the leg to the rest of the body. So it can increase perfusion or blood flow to most of the organs in your body. So it's a very forceful contraction. So if you have an artery that is not healthy, so what can happen? Do you know what type of artery that is not healthy? Like there's a term called aneurysm. You know what is aneurysm? You are not medical. So aneurysm is a term called the blood vessel is swollen. So a normal artery is a normal size, but when it's aneurysm, it's bengkak. So when it's bengkak, just like any physical structure, if you have same material that you use, just like a balloon. So if you have this balloon material, if you blow it to a certain size, it will shrink back. But if you overblow it for the same material, you have such a big size, then the material is very thin. So same principle, if you have an aneurysm, means a swelling of the blood vessel, can be anywhere. The one that's dangerous is in the aorta here, in the stomach, or up here. So if you have a swelling here, that's already swollen, and then you push up this massive pressure up, with the same material that you use, you can burst it. So if a patient say that I have an aneurysm, a medical term, or swelling of the blood vessel, then cannot use this because it can burst it and the patient will die in front of you. So the common place is in the stomach, in the aorta, in the chest. Another one is in the brain. So some patients have an aneurysm of the brain. If they have a stroke before, this is contraindicated. So patient with stroke, they have two types of stroke. One is a bleeding stroke, another one is a blockage stroke, called the ischemia stroke. So when they have a stroke, they say, "I don't want to do it." You can, but you ask them, what type of stroke that you have? Sometimes patient doesn't know, so they will bring the report, especially the CT scan. You must look at the CT scan. If the CT scan shows bleeding, cannot do, because it can cause harm. Because of bleeding, you force so strongly, it can cause another stroke. But if it's ischemic stroke, not because of bleeding, this machine may help. So there are some small studies that show that it improves their recovery from the stroke. If it's not bleeding, if it's bleeding, cannot. So I'm just talking on the principle, but some of the contraindication I've discussed along the way. You understand, right? Non-medical people can understand, huh? Okay. So this is the diagram here, very complicated if you are non-medical, but I will put it in a simplified form. So when you do this EECP treatment, you put the patient on ECG, correct? So ECG will measure the electrical rhythm of the heart. So you have this, the sharp thing, and then followed by another sharp spike. So between these two sharp spikes is the contraction and relaxation. So there are two sharp spikes. There are two small little lump here. They call it P wave and T wave. So don't worry about that. You just focus on the high spike. So if your machine, if a patient's, you put the ECG on, and then you can't really see the spike, then the machine cannot detect properly. So you must adjust the location of the ECG. So the standard one, they give you the ABC, same place. But sometimes everyone's heart is very different. You have to change the location until you get a big spike. If not, the machine will detect the small little one as another spike. You know. So the trick is you must change location to look for the biggest spike. So because the machine triggered by the ECG, so if you have the ECG, then you move. So this is also important principle because some patient, they have an irregular rhythm called AF. It's not regular, you know. So sometimes when it's irregular and they also have this small little spike, the machine become confused whether the heart is contracting or not contracting. So is it important to know when the heart is contracting, not contracting? Yeah. So let's say the heart is contracting and then the machine confused and thought that the heart is relaxing and contract. So the heart contract, this one contract, what happened? You have a conflict and fighting. So this, if you have a lousy heart, if it's a normal heart, like young people coming for just for wellness, no problem. But if you have a lousy heart, your heart contracting and you have a resistance coming out to you, it can cause harm because you increase work. So the guy has to work very hard. So to prevent this, you must make sure that the machine can detect when it's contracting, when it's relaxing by looking at this ECG. So this ECG is very basic and very important that you must put it so that the QRS is big. If it's not big, it becomes small, then you the machine become very confused, contracting or not contracting, then it can cause harm. So that's important. The second, just below the yellow thing, is the pressure graph. So you see, just after this one, no battery, still cannot get battery.
No, I can change for you.
You have the battery?
You have a battery.
Okay. So just below the yellow ECG graph is the pressure graph. So you can see there, straight after this sharp spike, the heart contract. So when the heart contract, you can see the pressure go up. So when the pressure go up, then the heart relax. How come there's still a pressure in the aorta? So after the contract and relax already, but you still have pressure. The reason is because, so the reason is because, so you contract, no more contraction, but how come you still have pressure? So this one, non-medical may not understand. The medical people ask, are you a doctor? Yes. So how come you still have pressure in diastolic?
Refuel.
Refuel. Yeah. Can you be more specific? It's a first year medical physiology.
The aortic valve closed and then the pressure is still there.
Why?
The diastolic pressure.
Why? How come? Because if you measure the pressure in the LV, after you contract, relax, actually the pressure is 0 or 10 only. But you still have a pressure of 80. So that's why you check your blood pressure machine. You have a systolic pressure, you have a diastolic pressure. So 120, 80. But if you measure the left ventricle pressure is 120, 0. Because you contract, relax. No, it's negative, nothing. But how come the blood pressure still have 80? It's because of because of elasticity, the recoil. Yes. So if you have a young artery, the recoil is good. Then you have a pressure of 80 because it can still, when you contract, it becomes like a balloon open up, and then when the heart not contracting, you come back and give you some pressure. So those patients who are very, very old, the artery is very hard. It doesn't have this recoil. So when you contract, they have this super high blood pressure because the aorta is not elastic. So the pressure becomes 180. So we call it systolic hypertension. Isolated only. Because the artery is so hard, it doesn't have this capacitance to maintain the pressure. So when the heart relaxes, the pressure drops to 40, 60. So there's a big pulse pressure. So as a GP who don't have any special machine like us, not so lucky, so you can do this. If you check the pressure is 180 and 60. Wow, so big gap. The guy's pressure, the artery is not good. It's a very, very hard artery. But the other reason is also, but most common is this. So a lot of patients have this type of big gap. Most common cause is the artery very hard. But another condition that you have to be aware, when the pulse pressure is so hard, pulse pressure means that systolic and diastolic very far apart, more than 60, 80, is aortic leakage, leaking valve. So if you have this patient, then maybe contraindicated because the pressure difference so big, maybe the valve is leaking. So So it's a sign that something wrong, you know. So you have the checklist for your stuff. If the difference between these two pressures is so high, wait first, don't do first. Send to doctor, or you can listen, you know, if you know how to listen for the murmur. So you can hear a noise, then cannot do. So pulse pressure very high with a murmur, then maybe is contraindication, aortic regurg. But most common one is because of the artery very hard, not elastic. That's why after they contract, then the pressure drop all the way down. So this portion here is the diastolic. So systolic, diastolic. So the machine works by contracting the balik in the diastolic phase. So you have a pressure here, but when you contract, it shoot back the pressure here, so that the force to go to the artery is stronger, so that increase blood flow. So when you do ECP, you expect this to go higher in the diastolic phase. So this is the stroke volume. So another function that it works is the heart contract. So contract means blood flow go out, and then later, when the machine relax, the blood flow also improve. So this one maybe not so important to you. I want to explain. So this one is what I described earlier. Most blood flow in the heart artery happens in the diastolic, because in systolic everything squeezed, so a lot of resistance cannot go. But when it's relaxed, every artery is relaxed, then more blood flow here. So this is a normal physiology, but the machine enhance this, increase the blood flow here, and at the same time also increase the stroke volume. So by increased blood flow there, then the blood flow to the heart is stronger. The second thing also it helps is by increasing the stroke volume, because of the when the machine comes down, then there's some flow further down. You understand? Non-medical can understand? Can I? Okay. So this is what we saw just now. This is systolic and diastolic. And then the EECP works by increasing the blood flow during diastolic. So during counter pulsing means ECP. Okay, so this is some of the measurement. So usually it looks like this, normal, before you do anything. But after the EECP, it increases the blood flow during diastolic during this phase. So this is systolic, this is diastolic. So increase the blood flow during the relaxation time. Okay, so this is in diagram format. So you understand, right? Okay. Okay, this one also very important. Before this machine was invented, they have another treatment called IABP. You heard of IABP? Intra-aortic balloon pump. So this one is a machine that we still use. Those patients with coming to hospital, heart attack, the blood pressure very low, you cannot do anything. You put a balloon into the aorta, not into the artery, just into the aorta, to support the heart with the low blood pressure. So cardiogenic shock, we use that machine. So in the ICU, we use that for patients with cardiogenic shock. So how is it done? It's an invasive thing. You put a tube into the femoral artery, you put it up here and leave it up here. So this balloon in the aorta have the same function. It contracts during diastolic, relax, deflate during systolic. Same principle, it increase blood flow to the coronary arteries and to the brain. Because when you are cardiogenic shock, not enough blood to the brain, you can have a brain damage. So this is an invasive balloon inside the aorta to increase blood flow during diastolic to the heart and to the brain. So this is invasive treatment. So with this principle, they invented this EECP. So EECP works by contracting your leg, the whole leg. So in your leg, there's artery and also vein, right? So artery and vein. So when you contract the artery, same principle, increase blood flow during diastolic. But you have a vein also. The leg has a lot of veins, and it has a lot of blood in the leg. So when you squeeze the leg, the blood will shoot up from the vein up as well. So the vein is the one that goes to the right heart. The artery is the one that comes up from the left heart. So if you squeeze the the blood from the vein to inside the heart, what will happen? You increase flow to the heart, right? So actually increase cardiac output, more blood, so more force will come up. But there's a group of patients, when you squeeze this, it can cause danger. So for doctors, what are the contraindications that you cannot squeeze so much blood into the heart? What are the conditions that you cannot squeeze so much? Huh? What's that? Pulmonary hypertension, yes, one. Like
AF.
AF, no, not AF. Heart failure. So if you have a lot of water in your lungs already, and you squeeze more blood into the right heart that goes to the lungs, you put them to pulmonary edema. So if your patient had heart failure, cannot do EECP. Can, but you have to make sure they are dry. So if they are not dry, means that their lungs have a lot of noise. So for non-medical, you don't know how to examine, you see the patient walking like so breathless, leg swelling, cannot do. You must dry them out first. If not, you squeeze this blood out, you can put them into pulmonary edema, they have to go to ICU. So that's another contraindication because of this principle. So there are a few things to watch out for, but you can predict by just one glance to the patient. When you come in, it's walking like so breathless and leg swelling, cannot do. You must send to the doctors first. Make sure their lungs are clear before you do. So you understand? Yeah. So this is just a general principle. So after they walk in, you see them not breathless, and then check their blood pressure. If their blood pressure, the pulse pressure, very big difference, 60, 80, something is not right. Then you must listen to murmur, the sound. Then also cannot do. So see patient walking, do the blood pressure, check the pulse, and then put the ECG. If the ECG is heart rate is irregular, a lot of atopics also cannot do because the machine are very confused to know which one is the real one and which one to pump. So these are the basic things that you do. Okay, so this is a contraction during diastolic when relax. Relax, let go when it's contracting so that it doesn't fight. If not, when you heart systolic contracting and this thing also contract is fighting with each other, so it cannot. So this one you all understand, right? It's a very simple logic. Okay, so some of you may say, what is the benefit of doing this? So just now I mentioned, it increase blood flow during diastolic. So those people with blockage, not enough blood flow, so increase blood flow. So this is the mechanical part, where increase blood flow. So by increased blood flow, hopefully the heart can have more oxygen and recover. So some of the marketing people will say, if you have a serious block, no need to go for operation and you just do this. I disagree. Because if you have a serious block, very unlikely that it become unblocked by just doing this. But it can work by increasing the collaterals, means that the small artery. But the big one, to unblock it, unlikely unless you take medicine and so change your diet and some of the lifestyle change. Otherwise, it's unlikely to get unblocked if you continue to smoke and eat happily anything you want. So must be combined with your lifestyle change. This machine will not unblock the serious block like this. So this image is a bit wrong. So it works by increased blood flow, hopefully increase collateral. But other effect is because of the increased cardiac output, because of increased blood flow, and then more blood into the heart. So this is a venous return, and then the unloading. Then this will increase more blood flow to the whole body, so increase perfusion. But this one will be something that more theoretical, but I think this is important as well. So if you exercise a lot, you'll be running and pounding on your legs, that is good for health. So what is the reason for that? So the walking and the running and all that will cause your blood vessel to be squeezed and all that. That will increase a lot of these chemicals in the artery. The main one is called nitric oxide, and you also reduce some of this bad one. So this will increase the endothelial function. Endothelial function is the thin layer of cells surrounding the artery. So if you improve this, the blockage will also reduce. So this is theoretical, but I think is important, and I think that also contribute to the benefit of this. So when you do EECP, if you have done it, it's a very massive squeeze to the leg and all that, the arteries. So this squeeze actually is a lot of stress, and this stress will release some of these chemicals. So some of the TCM people, they do this thing called paita. You know what is paita? Paita, you heard of it? Never heard of it? Okay. So paita means that they slap you, So they use force. Just borrow your hand. They use force, and then they hit hard on certain part of the body. So when you look at it, you say, well, no logic as a Western doctor. But actually there's some logic, because when you do that, you cause the blood vessels to be damaged. You break the blood vessel, you break the cells, and also you stimulate the arteries, similar to this. So some of these traditional people, and some of patients who fail your treatment, they go to see TCM and then do this, after that they recover. So there are some logic, because you release some of these chemicals. So same principle. Okay, so how do we select? So if you follow the guidelines and the convention, so for me, I'm a cardiologist, so I can only talk about the proper use. The non-proper use, you have to ask Alexa. Non-evidence. So this is a proper use. Patient with angina, stable or even unstable, also you can use. It's safe as long as they are not in heart failure, water in the lungs, and those contraindications are not there. Heart failure can be used as long as they are dry. So even though the heart is very weak, if they are dry, can be done. Heart attack, according to the indication, it can be used, but we don't use it because when they have heart attack, they are very unstable. So if something happens, they will blame it. This machine caused a problem, so we don't really use it. And patient with cardiogenic shock, you use an invasive one because it's more consistent, because we can use it for 3 to 5 days. If you use a pump, you cannot pump for 4-5 days, not possible. But the invasive one, we can just leave it inside and then pump. So we don't use it for EECP. So this one is the most common. This one, if you have to be careful, but this one rare. This one also not practical. Okay, so contraindication. Just now I have discussed already, but now it's just a revision. So hopefully you heard what I said and understand. So arrhythmia means that the ECG rhythm is not stable. So you can have this. This is a normal sinus rhythm, stable. You see this big spike and it's so regular. But when it's not regular, let's say you have this spike and then all this, most of the time it's very difficult to use unless the machine is very powerful, it can detect it. And then the other thing is that the machine works best when the heart rate is low. You see the heart contract and then this machine pump. So your heart rate is very fast, 100 or 110. You pump and relax, so not so useful. So ideally, patient that will work best, most ideal, is when the heart rate is about 50 to 60. So how do we do that? If they have a high blood pressure, you say take your medicine before you come. And then if they can slow down the heart rate with beta blocker, it's better that they take it before they come. So take their medicine before they come is better. In case, sometimes high blood pressure, you also control when you come. If it's high blood pressure also you cannot do because it increases blood pressure. So take medicine before you come. Okay. There's one time I have a patient that also very strange. I don't know whether Alex had this type of patient before. This patient is sinus rhythm, regular. but the machine keep having this trigger off. So normal sinus rhythm, but the machine like that. What's the cause?
I'll explain to you later.
Huh?
This has something to do with training.
Training? No.
This has something to do with training.
No.
Rapid training.
Okay, this is one. But if it's sinus rhythm, the machine still is there are many reasons. One is the placement of ECG, make sure it's big enough. So everything is done properly. The ECG is
It
big.
has to be done properly. The skin preparation must be done
Skin is
properly.
good so that the ECG is good. If it's not good, then a lot of this interference. But I have this patient that is very special. His body has a lot of this static pulse, Have you heard it? Have you had it before? This guy is very special. We do everything, but then it's still because
Iron Man.
it's like he has this a lot of static, So when you hold his hand, we reduce the static, then the machine can work. So we have to keep holding it. So the staff have to hold him. At first we discovered that. Then later we buy some of this earth wiring thing. So I don't know whether you have you can put that and reduce the static, and then it can work. So some human has this static electric that can cause this, but not common. Okay, another contraindication is that if you have a lot of bruises, bleeding, then don't do, because it may cause more bruises, and then they will blame you and say that your machine caused it. So one of the common side effects of doing this is that they can cause bad bruises and some scratch to the skin. So they must wear those soft pants, and also you have to watch out for this. So that according to the study, most common problem is this. And then if you have cellulitis or blood clot in the superficial vein, also is a contraindication, because if you have a blood clot there, you squeeze it, where does it go? It goes to your lung and can cause death also. So you watch out for this. You check the legs, make sure it's not inflamed. If it's inflamed, either infection or this is contraindication, because if it's infection, you squeeze, the infection will spread, and they said your machine can cause that. And then those patients with severe blockage of the artery of the legs. So if you are non-medical, how do you know the artery is not good in the legs? How do you tell? What's that? Pulse. Yeah, if you can feel the pulse, but you are not trained, very difficult to feel the pulse. So the way is by just looking, and if the blood flow is not good, the color is not darker, and gangrene. If you have gangrene, then you have to be careful. And then the skin is dry and all that. But for you, if you are non-medical, you can actually press on the toes, just like you press your finger now. You try. So you press on your finger, it should be red very fast. So if it's like you press, it's still white, that means the blood flow is very poor. So that's one of the indication. And then you can also ask some history. You say when you walk, you feel some cramps in your leg. If you have cramps in your leg, maybe you have lack of blood flow in the legs. And then you look at the legs, then you can roughly guess that they may have this problem, and you don't put this high pressure contraction, because sometimes it can cause more blockage, because some blood clot may shoot down and cause more ischemia. ABI, yeah, okay, good, yeah, you know ABI. So ABI, if you do properly, the pressure in the leg is low. When the pressure in the leg is low, then it's contraindicated. Yeah. But the simple one is ask the patient, if you walk, do you have cramps in your legs? And then just examine and look at the legs, gangrene, the skin, this doesn't look healthy. And also look at the flow. Okay, next one. This one I discussed earlier. If you have an aneurysm, so this is in the stomach. So if you have aneurysm, the wall is weak, and then you put so much pressure, it can actually burst it. So sometimes patient doesn't know that they have this condition. They may have it, but they also don't know, because This one is same system as the rest of the body. If you have block there, sometimes they also have an aneurysm in the aorta. So if they don't know, you also don't know. So no way that you can tell. Unless you are a doctor, you can examine, you feel for the abdomen. If you have a pulsatile mass that is expanding, then you may have this condition. You said, oh, you have to see a doctor first. If not, it can cause burst. Some patients have this problem, but they didn't know. So you examine, at least you save them from sudden death, because this one can burst. Okay, this one also we discussed earlier. Definitely no of using this machine when they have water in the lung. When you have water in lungs means that decompensated heart failure. So heart failure that is wet. If it's dry, you can still use it carefully. But if it's wet, you cannot use it. And then it can cause water in the lungs. It's called pulmonary edema. So if you're a doctor, there are a few ways to check. You listen to the lungs, a lot of noise, cracker. And then you can see this vein is very high up. So if you have this machine, when they squeeze, there's a lot of blood flow back. We call it venous return, and then go into your lungs and more water. So you are already flooding, and you add more water. That can kill the patient. Okay, severe pulmonary hypertension is one. So your pressure is already high in your lung. You increase blood flow, also more pressure. So that also is contraindicated. So how do you know that this patient has this problem? They should be breathless when you walk into your clinic. And then you look at the vein is very high up here. So it's a JVP high. So doctors only can tell. I mean, if you're not doctors, you have to learn the skill. And then if you have very severe high blood pressure, so before you do the test, if the pressure is too high, you should not do as well. So that's why those patients that is part of your program, you ask them to take their medicine before they come, at least 1 to 2 hours before. So when the pressure is lower, it's safer to do. Okay, this one is severe aortic insufficiency, means that the valve is leaking. So the principle that I said earlier. So how to detect? The blood pressure pulse is very big difference, and they have a murmur, they have a noise, so they have to contraindicated. Okay, warfarin. Some patients take warfarin for whatever condition, like AF or pulmonary embolism. If their INR is very high, that means they can bleed easily. So this is contraindicated. So how do you know? Sometimes difficult to tell. You have to ask them to show you the INR book. If their numbers is too high, you say cannot do. Or if you see a lot of bruises for no reason, also you should not do, because maybe it's too high. Okay, so what is a treatment protocol? According to the study, you should do continuously for 5 days. Every day is 1 hour over a period of 7 weeks. So some patients, they are very busy. They come maybe once every 2 weeks. That doesn't really work, because you need to do it continuously to force new blood vessels to form. So that's the theory, But so we should do it continuously. If they cannot do continuously, the effect may be not as good. So you may not see the better outcome. Sometimes you can do 2 hours every day for 3.5 weeks. So that one I'm not sure, but this is a standard protocol. And then based on the studies, most patients can complete this. No, some patients can complete, and some of these patients, they have to repeat it because they have persistent angina. So some patients improve, but some of them still have symptoms. They come back and do more, and sometimes the doctor and the patient will ask to do more, and it's quite safe to do it. Okay. So common reason for repeating the procedure is because of they continue to have chest pain, and so this. So how come some of these patients continue to have pain, but they still come to you? So you have to be careful. So who will benefit from this? If they have a lot of chest pain, angina, when they are doing their activities or when they are at rest, and you have to ensure that they are on the right medicine, and they still have symptoms, then this therapy is useful for them. And these symptoms sometimes stop them from doing some activities like going out, you are stuck in the home, then this treatment also is good. And some of these patients, they have unwilling to go for any operation. Then instead of deteriorating, this can be offered because their choice of not going for operation. This is their choice. So you document it that the patient don't want to do operation or angioplasty, then you can do this because at least this will improve their prognosis. And some of these patients with a weak heart, also they can consider doing this. So these are some of the patients that may benefit. This one we discussed earlier. Some patients, they have a serious block and they want to go for operation, but because the blockage is so serious and there's no place that they can put a stent or bypass, then they just have to continue to suffer and take medicine. And this ECP is indicated for them. There's nobody will complain that you are doing not the right thing. So there are some patients that cannot be done, and ECP is useful for them. So these are the same thing. Consider inoperable or very high risk for operation. This will be good for them. So heart failure patient can be used. As I said, you have to make sure that there's no the heart failure is not a wet heart failure, not water in the lungs. So it must be dry heart failure. Then this will help them. So heart failure, just now I said, most common cause of heart failure is blockage. So if your patient's lungs are clear, if you do this, you may help them because of their ischemic heart disease. So 2/3 of most of the patients with weak heart is because of a blockage. So blockage will be helped by. So one treatment can reduce the problem of these two, which is a blockage and also heart failure. I think that's my last slide. If you have any questions, you can ask me, and hopefully I can explain to you. You understand what I said? The non-medical you can understand, right? Okay. So you have any questions? If not, yeah.
What about those with prosthetic valve?
Prosthetic valve. Okay. So prosthetic valve. So most patients, some of these patients with prosthetic valve, if they underwent the operation too late, most of them will have atrial fibrillation. The heart rate is irregular. So when the heart rate is irregular, this machine most of the time it doesn't work properly. So if the heart rate is regular, if the prosthetic valve is working properly, and no leakage in the aortic valve, theoretically can be used. But if you have prosthetic valve, there are two types. One is a mechanical one is a non-mechanical one. If you have mechanical one, you have to take warfarin. So how can you be sure that the guy's warfarin is not too high? So to be safe, I advise not to do because one is because of warfarin. One also you don't know whether the valve has changed, become leaking. So try not to do that. It can be done, but you have to watch out all these things. The warfarin should not be too high, heart rate is regular, and you listen, there's no big murmur, then you can do. Okay, anything else?
After stenting or balloon, we can straight away do ECP.
Okay, so after stenting and balloon, can you do EECP? So after stenting, if it's an uncomplicated one, so they have a wound, so either from the hand or from the leg. From the hand, it should be quite safe. But from the leg, I think within 1 week you cannot do, because they may have a wound, the scab, the clot is not so stable. You go and squeeze, you can burst it and cause an aneurysm. So minimum 1 week to 2 weeks. 1 month will be safer, then you cannot blame it because the wound already healed. But within 1 week, if you burst it, then it's your fault because you create this massive pressure. Dialysis also not recommended because of the AV fistula. Because if you burst and you say, oh, how come burst? Because of your, maybe it's not because of this. So all these are fine line that you have to watch out.
Dr. Wong, how about bypass, post bypass?
Bypass, okay.
How long?
After bypass, I think that you have to wait for about 1 month. 1 month, and then also make sure the lungs are clear, no water in the lungs, and also the valve are okay. So after bypass, they should have sort everything out. The valve are okay, and then the blockage are okay. But because of the wound, so the wound increase the pressure, and sometimes some of these anastomosis can burst. So at least 1 month. 1 month. Yeah. But you see, 1 month is just standard general advice. But you must examine the patient. Sometimes the wound didn't really heal. That's not 1 month. Sometimes they have some wound breakdown in the leg. After bypass, they have this big wound on the leg, and you go and squeeze it, also cannot. So 1 month is just a general guideline. Sometimes some patients have complication with infection. The wound may take 2-3 months to recover.
So what about varicose veins or patient with venous insufficiency?
Yeah. So varicose vein, my advice also should not do, because their vein is already swollen and not so strong. So you keep squeezing it, sometimes it can cause bleeding. But that's my advice, but you can experiment. Tell us. So when you do this, because it's I think the Ministry of Health are watching carefully, So it cause harm, and then you are the first one to be in the newspaper. So you have to be careful. So do the proper thing first, Mr. Zaidi. Huh? Yeah.
What kind of level of blockage do you think can help by using therapy?
What kind of level of blockage? Those people with a serious block, either 1, 2, or 3 block, and still cannot be operated or refuse operation, this will help you. Yeah.
Is there medical data to show the positive result?
Positive result in terms of reducing the symptom and also preventing death, yes. But short term, you have to do every 1 year, 2 years.
And what's different if a person choose to do like once a week compared to like you say 5 days?
Yeah. So if you want to do this, you must do the proper 35. Yeah. So my advice is based on the research. It's not my experience. So you should do the 35 times continuous thing. After that, you can maintain it by every 1 week.
It says 5 days per week. Why can't we do just 7 days a week?
Can you also can if the center is open. It's even better. If you do 7 days every day, continuous, even better. Center must be open for you. And then after that one is just opinion. It's not based on facts. This is based on facts. You 35 times. After that, nobody knows what is the best. Yeah.
What about cancer patients? Can they do?
Oh, cancer patient. Okay, so cancer patient. This is not within what I can discuss. but my opinion, you should not do, because cancer sometimes blood flow can be damaged, and then they also have blood clot in the legs, DVT. After you squeeze, the blood clot go up, and then they may have aneurysm, because of the cancer, So you squeeze, and the blood vessel can burst, and then cancer, you want them to have less blood flow, so you increase blood flow. So it's not good, right? Logic. This is not. Nobody knows what's the answer, but I think logically they should not do. Yeah. Someone question there?
In case of pulmonary hypertension,
Yeah.
is actually no lung congestion. Is it advisable?
Oh, if you have a pulmonary hypertension, no lung congestion. So pulmonary hypertension, normally they don't have lung congestion, but if its pressure is very high, it's not recommended, because if your pressure is so high and then you squeeze more blood into the lungs, it may cause congestion. So depending on your level, if it's a mild pulmonary hypertension, no problem. But if it's severe one, the pressure more than 50, 60, 70, I think can be dangerous. And it's also not indicated based on the guideline. So, yeah.
Why is it most cardiologists disagree to really promote provision?
Okay. I'm a cardiologist. yeah. Most cardiologists, this one difficult to comment. A bit controversial. So today I'm here based on the research, not anything outside. So a lot of you are doing outside the indication. So that one you take your own risk, Yeah. Because I think cardiologists are unhappy because they are doing for all the other things that is not related to the heart, So like that.
Okay.
Kenny.
How do you document the improvement? Is it necessary? And also Muga scan with it. What kind of improvement objective?
Okay, so improvement, if you are a non-specialist, I think not so important. You use your subjective symptom improvement. But from the objective measurement, we can do the myocardial perfusion scan. So that can be done in IJN or Prince Court. So you measure it before and after. So this test, it costs you around 1,500 to 2,500, and it involves radiation like an angiogram, about 12 to 15 millisievert. So before and after you subject yourself for 2 radiation, which I also don't want to do, But your ignorant patient may do it because you ask them to do. So I won't do it. So it's based on the subjective thing, if their symptom improve, then you can use it.
Dr. Wong, if I may add, there is one non-invasive way of measuring, that is VO2 max, that you can actually quite a gold standard on measuring the.
Yeah. So VO2 max depends on how you do it. There are a lot of machine that is out there, and some of these are indirect measurement, So I'm also a bit suspicious how accurate it is. Some of my patients who has a very normal heart, their VO2 max is very poor. So it's very misleading unless you do the proper one.
The full VO2 max.
The proper one with the mask.
Yeah, with the mask
and all that. Who does it?
IJN.
IJN, you send patients
I
to IJN.
am speaking to UMMC to get this.
Yeah, so only the big center has it, and it's quite cumbersome and tedious to do. So if you can do that, also can either the VO2 max or the nuclear scan. The VO2 max is quite safe, but it must be done properly. So a lot of people say they can do VO2 max, but not the proper one. You can do in the sports center. I mean the ministry.
But the nuclear scan is much more better.
Nuclear scan is based on the study. Is a very objective one, and the study shows that very impressive. But the number of patients very small. It shows that those people with a lot of ischemia, not enough blood to the heart, after they do ECP, the flow improve. At least 50 to 60%, which is sometimes our operation also cannot achieve. So that's why I recommend to patients, if they are unable to do operation and also they don't want to do operation, then this is okay because of this study. Because of the nuclear scan study, because that is our gold standard. They can change their prognosis. If we can reduce ischemia, that means they can live longer. So I think that is the one that convinced me that this thing may work. Yeah. Any more questions? Any of you here has done it and show improvement? You want to share with us? Who you must have done it, right? You how? Huh?
No, enough yet.
Not enough. So you feel any difference?
Yeah, the point is like when you do for this ECP therapy, you should tell yourself that you are relaxing. Don't be too anxiety, and just take it easy. And over time, you will see that your parameters of measurement should improve. That's the most beautiful. One thing that I've been told, the parameter of nitric oxide reproduction will improve and that is most beautiful among all, because that will create your blood vessel to be elastic and even broader to help the blood flow improve tremendously.
Why do you do it?
Huh?
Why do you do it?
Why do I do it? Because I got stroke five years ago.
Stroke.
Yeah,
Heart no problem.
heart no problem, but the blood flow circulation is a problem. Even now we're talking to you, I'm nervous.
So after you do it, is it better?
Yeah, it's like that.
What's better?
In terms of numbness, in terms of because it's all blood flow. The most key ingredient is blood flow. If you have very beautiful blood flow, you can smile a lot.
Okay, thank you, Mr. Zaidi. So, patient with stroke, it's not part of the guideline, but there are some studies that shows that it helps. So stroke patient, I think can be done, but make sure it's not bleeding. If bleeding, then it can be contraindication. Yeah. Okay, no more questions. Then I'll stop here. Thank you. Oh, you are very okay.
Thank you, Dr. Wong. Can I have just 5 minutes of the time? Basically, we have an experience of more than 40 centers nationwide, from the far east to the far west, up and north. So, one of the things that I would like to share with you is that when you are selecting the medical device, make sure it is certified and is approved by MOH. Reason is because cardiologists and also YB Deputy Health Minister came to my booth 2 days ago. First question he asked, is it registered? So I said, definitely, we have the FDA license. And I think like what Dr. Wong is saying, that KKM is really eyeing on all the wellness centers operating by non-doctors. That is very you have to be very, very careful. That's one of the main reason why we conduct this free class for you all, so that you are more knowledgeable after the sharing by Dr. Wong. So apart from this, we are planning to have more continuous medical education by case of sharing with existing EECP users. Come and join us, because we want to share the knowledge. Want to share the knowledge in how a certain patient benefited. What is the protocol that is used? I have been working very closely with Dr. Kenny, sitting in front over here, and Dr. Peter from the back. So they have a couple of years of and multiple hundreds of patients of EECP patients that can actually help to enhance your knowledge. So apart of that, we will be sharing also ways of how to do the therapy correctly. I notice a lot of machine sellers, manufacturers, they don't actually teach you. They don't actually teach you, including myself. We have to we have to invest. We have to put a lot of effort and money just to make sure we are equipped with. So some things as little as getting the correct wave, the optimal pressure, the skin preparations. These are all not taught, and I was told you just switch on the machine, start, and let it run. So that is a very unprofessional way of doing things. I hope you all can bear in mind on this. We have also prepared some of the certificate of attendance for some of you who are registered with us. Please go and get it from our booth at just down there is booth 2007. So there is a certificate of attendance for this particular topic by Dr. Wong. So I'd like to acknowledge again Dr. Wong's time for sharing these very basic but also very thoughtful messages. Any further questions before we end the session? Yeah. So thank you for all your time coming over to KLCC and join us. Let's give a round of applause to all the people here. Dr. Wong, thank you for coming. So we have coffee for you once you visit our booth in booth 2007. So the coffee is free of charge. Please go and then our machine is down there for you to explore. If you have any question, I'll be here to. I'm pleased to answer to your questions. Yep.